All right. So I'm going to get going. Welcome, everyone. As you just heard, I am going to record this for folks who aren't able to join live. Um, for this presentation, you are welcome to be on or off screen. That's totally up to you. Um, as we move through, feel free to leave any thoughts, comments, or questions into the chat box throughout the presentation. We will save the chat and your responses will be recorded for feedback and for any future webinars and workshops that we do. And if any questions come up, please feel free to ask those in the chat box throughout as well. So welcome to a women's sexual health webinar called Empowered Pleasure. My name is Caitlin Shea. I am an MFT intern at the Relationship and Intimacy Center in West Des Moines, and I will introduce myself a bit more later. First, we're going to talk about the agenda that we will go through today. I've divided this presentation up into 4 different sections. We are going to go through defining sexual health, some anatomy and physiology, female desire and myth busting, and then we're going to end with talking about building bodily awareness and why that's important for our sexual health as well. And for each section, we'll also be going through a case study example of a client being seen in therapy so that we can kind of put put context into real life. So a little bit more about me. As I introduced myself in the beginning, my name's Caitlin Shea. I've worked for 8 years as a sexual and reproductive health nurse. For the past several years, I've worked in public health, and I am currently an marriage and family therapist graduate and intern at the Relationship and Intimacy Center. I really care about working with individuals and couples who want to embrace a shame-free, stigma-free, and sex-positive life, and of course, experience pleasure. So I'm currently finishing out my last year in graduate school with the goal to eventually become a licensed marriage and family therapist and hopefully one day a certified sex therapist working with couples. So for the first section, let's talk about what sexual health is and how we define it. Before I really dive into this, maybe just take a moment on your own to reflect into how do you go about defining your own sexual health? What does that look like to you? What are your immediate thoughts about your own sexual health? So, sexual health is it's multidimensional and unique to each individual. It is about knowing and understanding your unique sexual response patterns, embracing positive sexuality without shame, and it's about conscious attention to one's body, emotional needs, and context. And we will talk a lot about context in the upcoming slides. Healthy sexuality also involves an emphasis on comfort with one's own body, sexual desire, responsiveness, and positive intimate experiences. So when we describe sexual health as multidimensional, and it involves several key aspects. So physical well-being, meaning pleasure, comfort, and most importantly, absence of pain. Emotional health, meaning feeling safe, valued, and emotionally connected. Mental wellness, which can include positive self-talk and stress reduction. And social and relational, which involves communication, respect, and shared pleasure. So, like I said, sexual health is an evolving, holistic process supported by knowledge, self-acceptance, relational trust, and mindful awareness. It's really important to normalize fluctuating desire and seek connection over performance or what we call goal-oriented sex. So, what do I mean when I say goal-oriented sex? In the image on the left, you can see the general trajectory of goal-oriented sex, which is referred to here as the sexual staircase. This is what we would consider a standard script for sex, with the ultimate goal at the top of the staircase being orgasm. This could be a really fun and pleasurable concept for some. Oh, someone just said, Sorry, I'm checking the chat. You cannot see the PowerPoint, just the speaker. Is this true for other folks? I don't want to keep going if no one can see what I'm presenting. Okay, someone else said they can see the PowerPoint. Kim, I'm not sure why for some reason, excuse me, for some reason it wouldn't be showing for you. Robin also said they can see and hear both. Okay, all right. Thanks, Kim. Okay, I'm gonna keep going. So, orgasm at the top of the staircase. I think that's where I was. Um, So that is the ultimate goal in the goal-oriented sex concept is orgasm. So this could be a really fun and pleasurable concept for some people, but it could also be really restrictive, discouraging, and unhelpful for others, especially in any frustrations with achieving orgasm. So this concept, the staircase, is how we have generally culturally and socially learned is the default way to have sex. With the image on the right, the wheel model, there's a lot more room for nuance. It's a lot more realistic, a lot more inclusive, and attainable, and it leaves room for each sexual encounter to be different and individualized. And it can include or exclude any of the listed activities around the wheel. And a quick moment to credit these images to, you'll see at the bottom right hand of the screen, Dr. Lauren Fogel Mercy on Instagram. If you're interested in following her and you have an Instagram, she's a certified sex and relationship therapist and has really fantastic content if you want to check her out. So, we're coming into our first case study example, redefining sexual satisfaction. And I can't remember if I noted this at the beginning, but the names have not been changed. They're not reflective of actual clients. So, Maria is a 32-year-old married woman who tells her therapist that she often feels broken because she doesn't climax every time she has sex with her partner. She has internalized the idea that orgasm is the goal and admits that when that doesn't happen, she feels anxious, frustrated, and disconnected from her partner. During therapy, Maria begins learning about the difference between the sexual staircase and the wheel model. She realizes sexual intimacy can be about exploring touch, emotional closeness, laughter, and pleasure, not just reaching orgasm. Over time, she's able to reframe her definition of sexual health as being about connection, comfort with her body, and mindful awareness, which reduces her shame and allows her sex life to feel more authentic. So that's just a little bit of insight into why understanding definitions of sexual health and what it means to us is so important and impactful in our sexual lives. So, in this next section, we're going to discuss the basics of female anatomy, our biological differences in desire and sexual response, and why sexual awareness is so important. And just as a heads up, the next slide does have an illustration of a diagram of physical genital anatomy. It's not super graphic or anything, but just wanted to give a warning that there is an illustration on the next slide, and we will be staying on that slide for several minutes. Okay, so a brief overview of female anatomy. And just to note, when I refer to female anatomy here, we're strictly talking about cisgender female anatomy. So the anatomy that we'll be discussing is just for people who are assigned female at birth. So, noting the basics, when we talk about the vagina, we are referring to the reproductive canal. The vulva, excuse me, refers to the external genitalia. That's another thing that culturally gets a little bit mixed up in terms of definition, but words really matter, so we want to be really accurate about that. Another note, vulvas come in all different shapes, styles, colors, appearances, can look all different types of ways. So images in porn, for example, are often edited with tucking or retouching. They're not realistic representations of every single vulva on Earth. So same with the labia, inner and outer labia vary greatly from person to person. And the important thing to know is unless you're experiencing pain, your vulva is completely normal. So now we're going to talk a little bit more in depth about the clitoris. Um, in everyday conversation, culturally and even medically, we tend to use the word clitoris to only refer to the small external portion located above the urethra. However, biologically, the clitoris is far more expansive. It's made up of a network of erectile tissue that extends internally, surrounding the vaginal opening, and all of it is capable of filling with blood during arousal. And you can see the internal image of the clitoris on the right-hand side of this diagram here. This matters because it reframes the way we think about our sexual anatomy. When we reduce the clitoris to just the external idea, people may underestimate the extent to which arousal is involved with the entire structure. So instead of just being one spot, it's actually a really expansive organ with the same developmental roots as the penis. And if you see, I haven't included it on this image, but there are other internal clitoral diagrams. And from a side view, the interior clitoris actually does look a lot like an erect penis. So understanding this helps us validate a lot of different experiences of pleasure and sensations within our bodies. When we think about sexuality, it's also important to remember that our genitals are only one part of the system. This slide really highlights that the body, and specifically the genital anatomy, is the hardware of sexuality, but the brain and our environment together they complete the full picture. So, sexuality is not just about our physical structures, it's also about how our brains interpret touch, emotion, safety, stress, and context. So ultimately, knowing this reshapes how we talk about sexuality, not as just a narrow mechanical process, but as a whole body, brain body environment interaction. Knowing the full scope of the clitoris, for example, helps people move past limiting cultural narratives. And that way we can reclaim a deeper and more accurate understanding of our own pleasure. So now we are going to talk about one of the most important frameworks for understanding sexual response, and that is called the dual control model. This was developed by researchers John Bancroft and Eric Jansen and popularized in Emily Nagoski's book, Come As You Are. Before I move forward, I do just want to mention I have references at the end of this slide, but a lot of this content is heavily inspired and based on the wonderful book I just mentioned, Come As You Are by Emily Nagoski. And then also Dr. Lori Brado's Better Sex Through Mindfulness. We will be talking a lot about how mindfulness plays a role in our sexual health as well. So highly recommend those two books if you like the content in this webinar. So back to the dual control model of response. I like to think of this as the brakes and accelerators model, the stop and go system of sexual arousal. So looking at this image that we have on the screen, it's kind of a little balancing beam with two different sides. On one side, imagine that we have the accelerator. So this responds to sexually relevant cues, thoughts, sensations, and experiences that can turn a person on. On the other side, we have the brakes, and that detects any reason to not be sexually aroused. It is designed to respond to any perceived threats, distractions, or negative emotions. So each are highly individual and dependent on each unique person, and we're going to talk a little bit more in depth about that. So diving a little deeper, in the brain, there are these two separate but interacting systems. The accelerator, as we call the sexual excitation system, responds to any sexually relevant stimuli. And this can include things like touch, novelty, ambiance, a sense of attraction, or even certain fantasies. So the accelerator notices anything that could be sexual and says, yes, let's go. At the same time, we also have the sexual inhibition system, or the brakes. This system is equally important. It is designed to notice potential threats or reasons that sex might not be safe or appropriate. That could include worries about pregnancy, fear of being overheard, body image concerns, stress, shame, or any relationship conflict. The breaks basically tell us, no, not now, this isn't safe. So, arousal then isn't just about pressing the accelerator, it's also about what's happening with both systems together. Importantly, the brakes can be really sensitive in some people, meaning they need to feel deeply safe and comfortable before desire is even possible. And others may have accelerators that are much more easily triggered. Everyone's balance is different, and one isn't more right than the other. So, why does all this information matter? This model helps us normalize differences in people's arousal and desire. If someone struggles with low desire, it may not mean that their accelerator is broken. It may mean that their brakes are too active. So, context, which could be physical, relational, or cultural, all feed into how these systems operate. And this is where mindfulness can play a role. If someone becomes more aware in the present moment of what sensations trigger their accelerator versus their brakes, they can learn to work with rather than against their cultural patterns of arousal. So I often encourage folks to think of this model not just as biology, but as empowerment. Once you know you have both brakes and accelerators that are playing a role, you can start asking yourself, what pushes on my accelerator? What could ease off of my brakes? Just reflecting on that alone can unlock so much insight to your own sexual desire. So, another case study on brakes and accelerators in action. In this one, Tina is a 34-year-old teacher, and she reports feeling turned off during sex even though she loves her partner. She explains that her partner tries to initiate by lighting candles and giving her a massage. Sounds awesome, which she usually enjoys. However, she also admits that she often worries about her job workload and feels self-conscious about her postpartum body. Through learning about the dual control model, Tina discovers that while her partner's massage is a strong accelerator, her self-criticism and stress are simultaneously pressing on the brakes. Together, she and her therapist brainstorm stress management and body compassion practices to help ease those brakes, making it more possible for her accelerators to register more effectively. So in this next section, we are going to discuss some elements of female desire. We are going to review some common myths and misconceptions around female desire. And again, we will dive into why this is so important for us to know. So first, let's talk about desire versus arousal. We can experience desire in a variety of ways depending on the context and the sensitivity, of our brakes and our accelerators. Sexual desire is defined as the mental or emotional wanting or openness to sexual activity, and sexual arousal is considered the body's physical response reflecting sexual excitement. And this could be lubrication, erection, increased heart rate. There are two different patterns of desire that it's important that we understand. And we are going to dive a little bit deeper into these two called spontaneous desire and responsive desire. Some of us experience what is called spontaneous desire. So, this is the kind of desire we often see in movies or hear about in pop culture, where an urge for sex seems to just appear out of nowhere. It's like a spontaneous craving or a spark of wanting sex without much prompting. For some people, this is their frequent pattern of desire and it feels direct and immediate. And as I noted on the screen, this is often more common in men. For many others, desire works a lot differently through what research through what researchers call responsive desire. In this pattern, desire doesn't necessarily come first. Instead, it follows arousal. So the body might respond to touch, closeness, or the right kind of context, and then the mind recognizes, oh, I could want this. Responsive desire is equally healthy, equally normal, and in fact, quite common, especially over the course of longer relationships or in different life stages. And it is more common in women as well. What's important to remember is that both patterns exist and both are legitimate. There isn't one correct way that desire should work. For some people, desire feels like an appetite, hungry, spontaneous, like I said before. For others, it can feel more like an invitation that follows warmth, safety, or connection. For many, it can shift and change over time depending on context, stress, relationships, hormones, or simply phases of life. And also, the two can often interact. Arousal can come before desire, the responsive pattern, or desire may prompt arousal, the spontaneous pattern. I'm going to sound like a broken record here, but one is not better or more correct than the other. Um, you are not broken because you experience one over the other more often. So, just a quick pause as you hear these descriptions. Just take a brief moment to reflect on which feels more familiar to you. Maybe as I started talking and describing both, you immediately had one come to mind as that you recognized in yourself. I think being aware of that is really an important first step. So just take a moment to recognize spontaneous or responsive desire more common for you. Maybe you've experienced both at different times. Um, Recognizing your own pattern can help stop comparisons and to this cultural script that we have that really might not actually apply to your life or your body. And I also want to importantly mention, related to desire, something that Emily Nagoski briefly talks about in her book, defined as oh, my headphones just died. Let me know if you have any trouble hearing me now that I've switched to my computer speaker. Um, Arousal non-concordance. So this means that sometimes the genital response and subjective desire don't match, meaning your body responds physically without emotional wanting or vice versa. So this mismatch, excuse me, is normal, especially for women, and does not indicate that anything is wrong or that there's any brokenness. Okay, so now reviewing and busting some common myths and misconceptions. The first one we have is that desire always comes before arousal. We just spent a lot of time talking about this. So we know that to be false for many, especially for women. Arousal actually precedes desire. It's often only after sexual activity starts that desire kicks in that form of responsive desire. The next myth is that low sexual desire is rare. So, low sexual desire is actually very common. It affects about 1 in 3 women at some point in life and fluctuates with stress, mood, context, and relationship quality. The next myth is that genital response equals sexual interest. As I just spoke about with arousal non-concordance, the body can show sexual arousal in all sorts of contexts, including those that don't match a person's interests. Physical response and actual wanting do not always align, and that is a totally normal phenomenon. The next myth is sexual pleasure and satisfaction require spontaneous desire. So, fulfilling sex is possible with responsive desire. Pleasure can grow from context, touch, positive sexual experiences, and not just from anticipation. And the final myth is that women's sexual desire and pleasure fade irreversibly with age or menopause. So while changes do occur, sexual fulfillment is possible throughout the lifespan, especially when bodily changes, emotional needs, and relationship dynamics are addressed. And this is where mindfulness comes in, which we will talk about next. It can help build new patterns of arousal and desire. So, again, why does all of this matter? Mindfulness and education help individuals and couples navigate desire and arousal with curiosity rather than shame or worry. And then a quick note on monogamy. Navigating any relationship style is always rooted in context. So it's not that monogamy or polyamory is inherently good or bad for desire. One is not better than the other for desire. It's actually the way that people navigate monogamy or polyamory that can kill desire. So, like we said, it's all about context. Okay, and another case study example here, desire through context. Beth, age 42, describes her life with her long-term partner as comfortable but routine. She says she no longer experiences strong cravings for sex and worries her marriage is at risk. Through conversation, she learns that responsive desire often emerges from connection, safety, and context. She begins experimenting with intentional date nights and moments of playfulness with her partner rather than waiting for spontaneous sparks. With reduced pressure to want it right away, she finds that desire emerges naturally when she is emotionally present and relaxed, deepening intimacy and satisfaction. So, now we're going to wrap up by talking about the importance of building bodily awareness. The brain is the center of sexual response, our most powerful sex organ. Like I mentioned previously when we talked about anatomy and physiology, um, the genitals and the physical body is really the hardware to our sexual experience, and the brain and environment also play a huge role. The brain itself determines what we notice, how we interpret it, and whether or not we stay engaged in that experience. So, next we'll address the important role of attention and distraction, as well as cognitive barriers in sexuality. So, what a person pays attention to and how present they are greatly influences their sexual experience. The brain is responsible for attending to a sexual trigger, associating it with positive sexual memories, triggering the motivation for a sexual encounter, eliciting a sexual response, and ensuring that the body continues to respond to a sexual stimulus. Multitasking and distracting thoughts can be what we call the enemy of desire. This makes it really difficult to become aroused or enjoy intimacy if the mind is elsewhere. Mindfulness is a key tool for improving sexual desire, particularly in women experiencing low libido. First, how do we define mindfulness? Um, this could involve bringing purposeful attention to the present moment, ideally without judgment or criticism. Let's think about attention in general for a moment. What we pay attention to really shapes how we feel. If your attention is tuned into a sexual trigger like touch, closeness, or even a memory of a previous positive encounter, the brain can recognize that as something pleasurable and start a cascade of responses. It motivates us for intimacy, it sets off arousal signals, and it helps the body sustain its sexual responses. And on the other hand, attention does work both ways. So if our minds wander to stress, to-do lists, performance worries, or body image concerns, those distractions can switch on the brakes that we talked about earlier. That is why multitasking, which is something all of us have to pretty much constantly do, this can become the enemy of desire. It's really hard to enjoy intimacy if half of your brain is still in the workplace, still with the kids, still scrolling through the mental list of things that need to get done tomorrow. And this is where cognitive barriers come in. So things like anxiety, shame, self-criticism, or even the constant buzz of stress can all block the brain's ability to label sexual experiences as generally positive, safe, and worth tuning into. The brakes get pressed, and the sexual arousal feels distant. The good news is that we can retrain attention. Mindfulness is about practicing presence, bringing your attention back to your actual sensations with curiosity rather than judgment. Research does show that mindfulness, especially among women experiencing low libido, can significantly improve sexual desire and satisfaction by helping them notice pleasure without all the noise of distraction. So essentially, it creates space for the accelerator to do its job. So we're going to talk about some of these options for mindfulness-based approaches. The first on the list is just a basic daily mindfulness meditation. It could be 5 to 10 minutes of breath focus or body scan. This helps us develop skills for focusing attention and noticing sensations without judgment. There are a lot of different ways that we can bring in a daily mindfulness meditation. I think when a lot of folks think of meditation, they think of sitting on a cushion somewhere, completely still, eyes closed, mind blank. And that can be a really hard thing to practice. So there's a lot of different options. There's a lot of free apps out there that offer meditations. There are walking meditations that can be listened to on YouTube or on free apps. Even yoga is a way of just dropping into the body, bringing in some mindfulness, some presence, while still being able to sort of like move if you're uncomfortable with stillness. And I'm actually going to put my favorite free meditation app into the chat in case y'all are interested. Okay, the second option is an eating meditation. So this trains awareness and can later be transferred to sexual sensations. So just in practice, this could look like putting a piece of fruit in your mouth, noticing the feeling on your tongue, the texture, the immediate taste, and the immediate bodily response that occurs when you put the piece of fruit on your tongue. The next option is a body scan. So this is guided awareness of different parts of the body, noticing physical feelings or emotions. Because it's referred to as guided, that does mean that you would generally listen to something on an app or on YouTube that helps you scan through your body together. And this increases interoceptive awareness, which is the ability to sense internal bodily cues related to arousal and desire. The last one is taken from a sex therapy technique called mindful sensate focus. And it involves touching yourself or your partner with no intention of orgasm, but just noticing sensations. So it can start non-sexually with, just touching the hand, the arm, the face, and progress to erogenous zones as you feel comfortable, but again, no intention of orgasm as you move through this practice. Women practicing these techniques, there were some clinical studies done that showed that there was significantly increased sexual desire, satisfaction, and reduced distress or anxiety after just a few weeks of regular mindfulness practice. So essentially, mindfulness was able to help decrease rumination and catastrophic thinking about sexual performance and helps to accept natural fluctuations in desire and sexual response. And for all of these approaches, these can be done alone or they can be done with a partner. So where to begin? Start with non-sexual mindfulness. So as we talked about, breathing, walking meditation, body scan, and gradually introduce mindful attention to more self-touch, more sexual sensation. You can practice mindful sexual exploration. So just by noticing sensations, emotions, and thoughts as they arise, releasing any judgment or any expectations, especially any expectations that might come from that staircase model of goal-oriented sex, like we talked about. And then finally, you can really use mindfulness to recognize any triggers for anxiety or avoidance, and gently redirect your focus to that sensation, to that connection, dropping back into the body, being aware of the present moment. So, the final case study, shifting context with mindfulness. The client, Elena, age 50, recently entered menopause and worried that physical changes meant the end of fulfilling sex. She discovered through mindfulness-based exercises that focusing on emotional context, warm connection, slowing down, and present moment awareness helped reduce her anxiety. Practicing mindful breathing during intimacy eased her breaks, which was stress and fear about body changes, and enhanced her accelerators, which included touch, closeness, and safety. Because of this, Elena was able to reframe her sexuality not as a mechanical process dependent on hormones, but as a whole brain, whole body experience shaped by her own attention and context. So, I would like to close this presentation today with a brief mindfulness practice, just to sort of drop in and give a little example of something that you can do on your own or with another that can be sort of an intro to mindfulness. So, this will just take about 60 seconds to 2 minutes. Feel free to stay off camera. Um, you will begin by just sitting comfortably, having both feet flat on the floor, your hands resting in your lap or your thighs. And if you feel comfortable doing so, you are welcome to gently close your eyes or even just soften your gaze to a spot in front of you. Slowly start to bring your attention to the feeling of your body, making contact with the chair or the floor beneath you. Notice the support that's holding you up. No need to change anything, just observe the sensation of being grounded here. And start by taking a slow, deep breath in through your nose, filling your belly gently, and releasing it slowly out through your mouth. Notice the natural rhythm of your breath, letting each inhale and exhale anchor you in this moment. Now I invite you to scan your body from head to toe, starting at the top of your head, noticing any sensations, any warmth, tension, tingling, ease. And slowly start to move that awareness down to your face and your jaw. If you notice any tension, see if you can let it soften with your next exhale. We often hold a lot of tension in the jaw, so maybe just soften the jaw automatically. Then go ahead and move your awareness down to your neck, shoulders, and arms. Notice the weight of your arms resting, the feeling of the air on your skin, and just take notice of any sensations, whether they are pleasant or neutral. Continue to scan downward now to your chest, noticing the rise and fall of your breath, your upper and lower back, your abdomen, and your hips. Again, there's no need to judge or fix, simply just become aware. Finally, shift your attention to your legs, knees, and feet, noticing any contact with the floor. Maybe your feet are flat on the floor. Notice any warmth, coolness, or any subtle vibrations. And if your mind wanders, gently bring it back to your breath or the part of your body that you're noticing. And each time you return your attention, that's a very important part of this practice. So any distracting thoughts, any to-do lists, just bring your attention back to the body. And we'll end this by taking one more deep breath in, inhaling through your nose, maybe pausing at the top of the breath, holding for a moment, and then exhaling slowly out the mouth. And when you're ready, gently bring your attention back to this space, perhaps by opening your eyes, stretching, noticing the room around you. Thanks for taking that couple minutes with me. That was just an example of coming into the body, a gentle, really quick body scan that you can do at any point throughout your day. And thank you so much for being here during this webinar. I've included my email at the bottom of the screen, so please do reach out with any feedback, questions. Ideally, we will be doing a future workshop on this information. So if there's anything that you'd want to know about more in depth on any of these topics, please let me know. I'm also available to book with at the Relationship and Intimacy Center. So you can do that through our website, or again, feel free to email me if you're interested. And just for ease, I will drop my email into the chat if you're more of a copy and paste kind of person. And again, this webinar will be, we recorded, so we will make sure to distribute this recording as well. All right. Thank you so much, everyone. Take care and have a great evening.